I went in for a comparatively minor operation to have a... they were going to explore the bile duct and eventually put in a stent.
Then the next thing we knew was that we had a phone call from the hospital requesting that we come down as Mum was very, very poorly and they weren't sure whether or not she was going to pull through.
The first thing I actually knew was when I was trundled off into a single room and then developed the most fearsome diarrhoea.
I was greeted by one of the sisters, the junior sisters, to ask me to gown up as Mum had, quote, a little bit of diarrhoea.
I was infected with not only MRSA but C. difficile, which is a very nasty piece of work.
We were quite shocked as a family in seeing how quickly she was losing weight, how quickly particularly short-term memory issues were becoming a problem. But again, we asked those questions of the staff and really we didn't get any real response or any sort of reassurance, really. We felt as a family that we needed to find out for ourselves what the situation was. The drugs that she'd been given were very clearly connected with the MRSA. At that stage, we asked why she was on that particular drug regime. We were constantly put off and eventually I spoke to the senior sister on the ward and said to her, look, we need some more information as a family because at the moment we're getting information off the internet which really doesn't combine up with a whole range of other information we've been given. We're getting worried. We really don't know where we stand with this. We don't know what the prognosis is for Mum and we need some more answers. We raised questions over that and I was told at that stage that I was being overzealous and overcautious.
Went home, I think again because they were worried that I would pick up something, sent me home, wasn't very well, had to come back, and the only place they had a single room was in a stroke ward where there was not very good care, I'm sorry.
Not only was it an incredibly depressing ward, but I also feel that the standard of nursing care in that ward was abysmal.
She was to say there was nothing more they could do for me there.
We think your mother is going to be better at home because the chances of her picking up any more infections at home are limited compared to picking up further infections within hospital.
But then when it got worse, then obviously I had to come back in again because nobody could cope with that at home, and besides it needed more care.
On the third admission to the hospital, the consultant at that stage very clearly said, no, let's hang on, get her off all the drugs that she's on. We need to actually investigate what's going on and we need to make sure that investigation is as broad and as sound as it needs to be.
Things eventually got better with the treatment I got given.
The overwhelming feeling that all of us got as a family in hospital was it was about managing it once it happened, not about preventing it before it could happen. The whole of the family saw absolutely inspired moments of professionalism, absolutely inspired moments of professionalism. And if it wasn't for that high degree of professionalism, we know that Mum wouldn't be around right now. And so thank you very much, basically, that's all I can say. But on the other extreme, there was nothing. And there didn't seem to be anything in the middle at all, absolutely anything. It was either extremely good practice or extremely bad practice.
The control of infection in hospital depends not just on one person, it depends on us all, both as visitors and as patients. And if any one fails, then you've got these circumstances which will allow infection to flourish.
Because when the practice was good, it was brilliant. And when the practice was poor, it was horrendous.
Shall we say, a little more wary. That's the nice version.